How do you know if you injected your medication correctly? You know you injected correctly when you hear two distinct clicks and see the gray plunger fill the viewing window after holding the button for about 10 seconds. If you're using Zepbound, you've probably wondered at some point whether you actually got the full dose. It's a really common question, and getting it right matters for your treatment to work as intended. Let me walk you through exactly what to look for so you can feel confident about your injections. Zepbound is a medication that works on two different hormone receptors, GIP and GLP-1. It's FDA approved for chronic weight management in adults. Like other injectable medications, proper technique really matters for getting the benefits your doctor prescribed it for. The good news is that the Zepbound pen has built-in indicators that tell you when you've done it right. Here's what to watch and listen for. First, you'll hear a click when you press the injection button to start. That's normal, but the key thing is what happens next. You need to keep holding that button down, and according to the pen's instructions for use, this takes about 10 seconds. During that time, watch the viewing window on your pen. You should see a gray plunger slowly filling that window. Then you'll hear a second click. That second click, combined with seeing that gray plunger fill the window, tells you the full dose was delivered. Both of those things need to happen. The two clicks and the gray plunger filling the window. If you only hear one click or you don't see that plunger fill the window, the dose might not have been complete. What should the injection itself feel like? Honestly, not much. You might feel a slight pinch or some pressure, but it shouldn't be painful. Zepbound goes into the subcutaneous tissue, which is the fatty layer just under your skin. The approved injection sites are your abdomen, avoiding about 2 inches around your belly button, your thigh, or the back of your upper arm if someone else is giving you the injection. It's important to rotate between different sites and different areas within those sites. Don't use the exact same spot every time, and make sure to avoid any areas with bruises, scars, or irritated skin. After you remove the pen, the injection site should look pretty normal. Maybe a small red dot where the needle went in. You might see a tiny drop of blood or clear fluid, and that's okay. But if you're seeing medication leaking out, that could mean the needle came out too soon. Let's talk about some common mistakes people make, because knowing what not to do is just as important. And the biggest one is pulling the needle out too early. Remember, you need to hold that button down until you hear the second click and see the gray plunger. If you pull out after the first click, you probably didn't get the full dose. Another mistake is injecting the medication when it's cold right out of the refrigerator. Let your pen sit at room temperature for about 30 minutes before injecting. Cold medication can be more uncomfortable. And never use external heat sources like microwaves or hot water to warm it up. Just let it warm naturally. Not rotating your injection sites is another issue. Using the same spot repeatedly can cause lumps under the skin or changes in how well the medication absorbs. Keep track of where you injected last time and move to a different area, at least an inch away from your last injection. Before you inject, take a moment to look at the medication through the viewing window. It should be clear to slightly yellow. If you see particles or it looks discolored, don't use that pen. So what if you think something went wrong? What if you didn't hear that second click or the plunger didn't fill the window? Don't give yourself another injection to make up for it. That could lead to getting too much medication. Instead, contact your healthcare provider or call the manufacturer for guidance. They can help you figure out what happened and what to do next. Now, regardless of whether your injection technique is perfect, there are some symptoms that mean you need to contact your doctor right away. Severe abdominal pain or persistent vomiting are red flags. Signs of an allergic reaction like difficulty breathing, swelling of your face or throat, or severe rash need immediate medical attention. Zepbound has a boxed warning about thyroid C-cell tumors. If you notice a lump in your neck, hoarseness, trouble swallowing, or shortness of breath, contact your doctor. The medication is contraindicated if you have a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Before we wrap up, I want to emphasize that this information is educational. It's not a substitute for the hands-on training you should receive from your healthcare provider or pharmacist. Always follow the specific instructions for use that come with your pen and the guidance your doctor gave you. If anything about your injection technique is unclear, or if you're experiencing side effects, reach out to your healthcare team. Let me recap the key points. You know you injected Zepbound correctly when you hear two distinct clicks and see the gray plunger fill the viewing window. Follow the pen's instructions for use carefully. Rotate your injection sites. Let the pen warm to room temperature before using it. And never redose on your own if you're unsure whether the injection was complete. If you found this helpful, hit that like button and subscribe for more evidence-based health information. And drop a comment below. What questions do you have about injectable medications? I read every comment, and your questions help me know what to cover next.